Hi viewers, this is Dr. Sivakumar, Consultant Pulmonologist, LK Hospital, Pallavaram. Here we are going to see something about the respiratory medicine and the diseases and the disorders that are involved in it. Life starts with the breath and it ends with the breath. What we are dealing are the things that are between these two breaths, and the specialty that is very much concerned with this lung and health and lung and breath and health and life is the respiratory medicine. Here, let me tell you about the common symptoms and the common diseases and the treatments that are available to treat the lung disorders. Okay. First thing, we will see what are all the common symptoms by which we are seeing the patient's day-to-day basis. The most common symptom is the cough. Patient may have a difficulty in breathing, wheezing, fever, chest pain, and sometimes blood will be coming after the cough. That is, it is called as hemoptysis. These are all the common symptoms what we see in a day-to-day basis. Whenever you have any one of these symptoms, you have to have a consultation with the lung specialist. Okay. The second thing is what are all the common diseases we will encounter when we are seeing patients is the most common diseases are related with allergy and bronchial asthma. COPD, it has been associated with 50% of the smokers, and it is also associated with the environmental pollution and COPD. Third thing is pneumonia. Whenever we are having some kind of infection in the lung, we used to call it as pneumonia. We all know that the past 2 years we are all in the hands of COVID, we can say, and nobody can deny that each and every one will be now aware of more and more importance of the lungs through this COVID pneumonia. And I think most of our homes will have a saturation monitor also, that is pulse oximeter, by which we will self-monitor our saturation in the blood. Okay. And this pneumonia, it can be of different types. It can be a bacterial pneumonia, or it can be a fungal pneumonia, or it can be a viral pneumonia. What we are all dealing now, this COVID is a viral pneumonia, which seems to be very dreadful, and now we are in the second wave of COVID and we need to be very careful. We should not let our guard down. We have to have a sanitization, masking, self-distancing, and all those things which we followed in the first wave also. The most importantly, go and have your vaccine, right? COVID is almost near us and it is going to grab us. We have to be very careful. Please don't let your guard down. Okay. And the third most disease, as I told you, is the pneumonia, that is infection of the lung. And the fourth disease what we see is more and more increase of lung cancers, that is lung malignancies. That is because of increased incidence of smoking among the population, and also because of environmental pollutes, because of the vehicles, because of the industries, because of the so many factors. We are having more and more incidents of lung cancers than previously. So, and the fourth important disease is an interstitial lung disease, we would say, and that is concerned with the scarring of the lung parenchyma. It can be due to multiple factors. So these are all the important diseases what we are doing day to day. And the most importantly, in a recent time, sleep related disorders are on rise. That is because of so many factors like stress, obesity, and those things. Sleep related difficulty in breathing, which we also called as sleep apneas. It can be divided into two: central sleep apnea and obstructive sleep apnea. And what we deal with are the OSAs, that is obstructive sleep apneas. Okay, and other important thing which we deal with are the infections of the pleura and diseases associated with the pleura. That is, it is a layer which surrounds the lung. Okay, we can say it is like a skin of the lungs. Okay, we can have a pneumothorax, we can have the pleural effusion, it can be a hemothorax, it can be the pleural malignancies. So these are all the diseases that have been associated with this pleura also. So these are all the very common diseases what we see in our day-to-day practice, and very importantly our role in intensive care, because as a chest physician, as a pulmonologist, our role in the management of ventilators and in the management of the non-invasive ventilation, oxygen, intensive care, all those things are very, very important. So it is a specialty that has been growing in and out for the last 1 decade, and we are expecting a huge bounces in the management of the disorders of the lung and also these ailments, actually respiratory ailments that are associated with the lung. And how do we diagnose this lung disorders? Okay, the most important investigation which we used to take is nothing but chest x-ray, and that will depict almost 70% of the information what we require about the disease. And the second most is CT chest, and the third one is pulmonary function testing, that is through the spirometry, DLCO we used to assess the diffusion capacity of the lungs. And the fourth important one is bronchoscopy, by which I can say this bronchoscopy has almost revolutionized the field of our specialty, because the more and more need of bronchoscopy has been documented in the recent past years. And the next one is very importantly sleep study and thoracoscopy for the pleural diseases. All these are the investigations that we commonly use to diagnose a disease. So as a viewer, as a public, and as my friends, I want you to be very well aware of the lung disorders and the diseases and the common symptoms that has been associated. And we in our hospital is always in the need of you, always in the service of you in treating all these ailments. Okay, and have a good lung, have a very healthy life. Thank you so much.